Welcome. This presentation will cover aggressive behavior, how to recognize it, what causes it, and how to treat it. There's an enormous variation in the criteria used to define aggression, both amongst researchers, behavior professionals, veterinary professionals, and the general public. This means that when we talk about aggression, we need to clearly define our terms. The definition I will use is species-specific affective behavior that harms or threatens to harm another individual. Often, fear or frustration underlies aggressive behavior. Aggressive behavior acts can be broadly divided into defensive and offensive aggression. Defensive aggressive behavior includes a lower than neutral body posture, such as a lower than neutral ear position and tail position, ears pinned back, averting their gaze, and their weight shifting back. This is often seen in dogs who want to avoid conflict initially. Offensive aggressive behavior includes a higher than neutral body posture and higher than neutral tail and ear position, their weight shifted forwards, a higher arousal, and fixated staring. This is often seen in dogs who are confident in their approach and intend to engage with a threat. However, both are responses to acute stressors, which range from very subtle behavior acts and autonomic responses to more explosive, bigger behaviors such as growling, lunging, or biting. Offensive and defensive aggressive behavior acts can occur simultaneously or consecutively too. This is called ambivalent behavior. Note that body language is often misunderstood, and body language alone doesn't tell us enough about the behavior and its function or the emotional state of the dog. Though we often see a lower than neutral body posture in fearful behavior and a higher than neutral posture in confident behavior, this is not always the case. Looking at body posture, behavior acts, and behavior systems is just a small part of analyzing behavior. The popular ladder of aggression, pictured here, shows how behavior can increase in intensity when subtle signs of distress are ignored. Though this can help clients recognize these more subtle signs and as such intervene earlier, behavior doesn't follow a neat ladder. It varies per situation. It's influenced by momentary behavior-altering effects. It follows an antecedent, a trigger, the intensity of which impacts the behavioral response. And it's shaped by consequences. For example, a dog whose subtle signs have been ignored will learn to use more intense behavior in the future. It also varies per individual. For example, some dogs physically cannot show these behavior acts due to their morphology, and individual differences in temperament play a role too. The ladder shows an ideal world progression of fear-related aggression. It includes body language indicative of fear and lower than neutral body postures, but not all aggressive behavior is due to fear. For more information on body language, please watch my canine communication and behavior presentation. Apart from offensive or defensive body language, aggression is also described by the target, such as familiar or unfamiliar dogs or familiar or unfamiliar individuals of other species, such as humans. Objective, operationalized descriptions are fundamental for behavior science, but as mentioned before, the criteria used to define aggression vary enormously. This means research and statistics on the prevalence of human-directed aggression, dog-directed aggression, and bite incidents vary. And apart from poor definitions, other problems in data collection, but also social cultural differences and public perception are of influence too. Our own perception of the prevalence and severity of dog bites are also influenced by our own experience and professions. This doesn't mean that the risks and the effect on guardians and society should be downplayed. Aggression, including bite incidents, are a serious problem, especially for the individuals involved. Aggression towards unfamiliar people often involve aggression during veterinary examinations and grooming, fear-related aggression, including aggression to visitors, and aggression exacerbated by frustration, for example due to physical barriers or the removal of options to escape a threat. Aggression to familiar people often involve possessive aggression, where the dog fears or is conflicted by the approach of a human when they are in possession of a to them valuable resource. Aggression related to fear, discomfort, or pain when being touched, groomed, or receiving medical treatment. Aggression related to being disturbed, think of suddenly touching a dog when they sleep. And conflict behaviors in the ecological sense, when behavior from two or more behavior systems occur at the same time and result in internal conflict, think of redirected aggression. Most research suggests that the prevalence of dog bites is highest amongst children under the age of 10. Bites occur to the face and head more often and are mostly inflicted by their family dog at home. Factors that may be of influence are child development specific and a lack of knowledge about canine body language. Think of movements and noises made by children which may be scary or aversive to dogs. Grabbing and touching the dog, leaning in intrusively, or disturbing them. Safe interactions with the family dog require an understanding of canine body language and behavior from their guardians and the children. Management is often easier in cases of aggression to unfamiliar people. In case of aggression to familiar people, management and behavior modification can, depending on the case, be more difficult. Guardians whose dog's behavior poses a severe risk often get trapped in bureaucracy surrounding refusals from shelters, lack of treatment or knowledge, refusal of euthanasia, and police, social services and local laws being involved. Then dog-directed aggression. Aggression to unfamiliar dogs often involve resource holding potential, fear-related aggression, fear and frustration related to aggression, notably to passersby and influenced by barriers or lack of escape, and conflict behaviors. Aggression to familiar dogs often involves intraspecific agonistic behavior, including aggression, resource guarding, and also conflict behaviors. Note that these categories only describe the target and possible motivations, and to know why an individual dog is behaving in a specific way in certain contexts, we need more information. It's also important to realize that aggression is not a temperament trait. A dog acts aggressively in certain contexts, but they are not an aggressive dog. There are many different categories of aggression described, such as maternal aggression, fear aggression, territorial aggression, possessive aggression, pain-related aggression, and many more. Though many of these are outlined in veterinary behavior diagnostic literature, they differ, both in terms of descriptors, criteria, their function, and the observed behaviors. A review of these categories of aggression back in 2002 identified 26 different categories used by different authors of veterinary behavior literature. Only one affective aggression category was used by all authors, which was fear-induced aggression. Another agreed-upon category, predatory aggression, differs from affective aggression in terms of function, topography, ethological categorization, and neuronal pathways, and is not commonly described as aggression anymore. Using labels risks us defining the dog and making assumptions rather than accurately describing the behavior we observe. Guardians, but also other professionals, interpret labels differently. How you describe a dog's behavior matters. Diagnostic texts often make a distinction between adaptive and pathological aggression too. Inappropriate responding, such as failure to pick up on social cues from other dogs, or the lack of showing more subtle signs before escalating in intensity, can be incidental and context-specific. Though we often hear dogs are avoidant and want to appease or calm situations, even within normal social interactions, miscommunication happens. In these cases, the intensity of the response is appropriate in relation to the intensity of the trigger, and the behavior is variable and flexible. A dog adapts their response accordingly to the social interaction or trigger. It may also be a pattern of behavior as a consequence of a lack of socialization or other factors within their learning history. For example, when subtle signs are ignored often, a dog might proactively skip these in future situations. If the aggressive behavior is categorized by disproportionately intense responses to benign interactions or triggers, or the dog is unable to return to their baseline level of arousal once a trigger is removed, the aggressive behavior can be defined as pathological rather than adaptive. But because all aggressive behavior acts, whether they are seen as adaptive or pathological, are caused by an activation of the stress response, and are not based on a well-differentiated underlying neurophysiology or pathology, all the proposed different classifications of aggressive behavior are subjective. Diagnostic texts do, however, often provide information regarding differential medical diagnoses and psychopharmacological intervention, which can be useful but only if they are informed by a detailed history taking. This includes motivational factors such as medical history, medication, living situations, daily activities, motivating operations, learning history, including development, socialization, and trauma. It includes a functional behavior assessment. This involves locus, magnitude, absolute and relative frequency, latency, duration, the topography of the behavior, and its hypothesized function. Think of escape, attention, sensory, access, control for outcomes. The possible emotional pathways. It looks at the onset of the behavior, whether it's sensitizing or generalizing or not. The antecedents and consequences. This is the context of the behavior, what triggers it, who's the target, what type of consequences are involved, are they intrinsic or extrinsic, reinforcing or punishing, or if it's a respondent behavior. And behavior acts and systems. What does the behavior look like? What ethological behavior systems does it fall under, and are there any observable physiological signs? And a risk analysis. All this information is needed to make database decisions, design a behavior modification plan, and to inform psychopharmacological intervention and measure its effect. In case of aggression, a risk analysis is extremely important. It includes bite history, when did the bite occur, the bite context, specific context of the bite, what happened before, what happened after, the bite level, this identifies the severity of the bite based on an evaluation of the wound pathology, the victims, age, gender, are they known or unknown to the dog, and the bite location, so where on the body did the bite occur, and the guardian's ability, can they manage and prevent the behavior, does it impact their quality of life, what has been tried before in terms of behavior modification and medication, and whether or not other behavior or medical problems exist which influence the risk too. So what causes aggression? Well, behavior is a functional product of the combined effect of biology and genetics, learning, evolution and developmental history, and social factors. For more information on this subject, please watch my multifactorial courses of behavior presentation. For this presentation, I will zoom in on some biological factors, including medical problems related to aggression. Let's start with genes. Breed is not a good predictor, but selection for function can increase the risk of a disproportionate number of dogs within a breed showing pathological aggression. Loci associated with highly selected for morphological traits, namely small body size, have been identified to be associated with owner-directed aggression and aggression towards unfamiliar dogs and humans, amongst other behavior problems. However, this doesn't mean morphological traits are a good indicator for the development of aggression. Behavior is genetically complex. There are also heritable disorders that have a behavioral component. For example, two of these are the L2-hydroxyglutaric aciduria, which is an inherited neurometabolic disorder affecting dogs which progressively damages the brain, and a poly-A expansion in the dopamine transporter that's associated with differences in behavior and activity in Belgian Malinois. Many behavior problems likely have a polygenetic component, but environmental triggers are likely necessary for these traits to manifest. Neurotransmitters involved in aggressive behavior include serotonin, noradrenaline, dopamine, glutamate, and acetylcholine. Low levels of serotonin in the prefrontal cortex increases the amount of dopamine and noradrenaline, which increases the probability of aggressive behavior. Serotonin modulates emotional responses and aggression, and lower levels increase impulsivity and risk-taking behavior to a perceived threat. Dopamine is involved in impulsivity, and noradrenaline affects vigilance and arousal, and is involved in the fight-flight response. Even though anomalies in neurological functioning are known to be associated with aggressive behavior, there are no commercial tests available to diagnose neurotransmitter function. Use of psychopharmaceuticals such as SSRIs or TCAs may greatly improve aggressive behavior problems, but they should always be used alongside behavior modification. Neuroendocrinology. Sex hormones affect the sensitivity of neural pathways involved in behavior, including aggression. Synthetic hormones or dopamine agonists can induce or block hormonal processes, and so does castration. The neuroendocrine system is involved in regulating stress via the HPA axis and sympathetic nervous system, which releases adrenaline and noradrenaline and may lead to a fight or flight response. Chronic stimulation of the HPA axis may result in medical and behavior problems. Thyroid hormones play an important role in behavioral control. Hyperthyroidism and hypothyroidism contribute to anxiety and can present with aggression. Hypothyroidism increases the turnover of serotonin. Neoplasms, such as pituitary-dependent hypoadrenocorticism, can cause irritability and aggression too. Treatment may include testing and treatment for endocrine disorders. Other medical problems include degenerative diseases such as canine cognitive dysfunction, which can increase or lead to fear, irritability, and aggression, or degenerative joint diseases, which can cause pain. Neurological disorders include forms of epilepsy, which may present with aggressive outbursts, and neoplasia, such as lesions affecting the hypothalamus, limbic system, and temporal lobe, can cause aggression too. If a dog presents with sudden onset of aggressive behaviors, this may very well be pain-related. The previous slides discussed some medical treatment options of aggressive behavior and the use of psychopharmacology. However, medical treatment alone in most cases is not sufficient, as behavior is multifactorial, learning always occurs, and many medical problems cannot be cured, only managed. What type of behavior intervention is useful depends on each individual case. Treatment plans often include the following. Taking data. Treatment plans based on detailed behavior analyses allow for making data-based decisions. Medical treatment, if the behavior is linked to medical problems. Psychopharmacology, if the behavior impacts quality of life, is disproportionate and difficult to manage. Education, teaching guardians about canine communication, for example, the function of a dog's behavior and the risks involved. Management, this includes preventing the behavior from occurring. Depending on the function of the dog's behavior, this can range from setting rules for members of the household, think of not taking items away from the dog, or giving the dog a safe space when they are not disturbed, but also wearing a muzzle out on walks or not walking in busy off-leash areas. And it also includes having safe strategies ready to intervene when the behavior does occur. Again, it all depends on the actual behavior the dog struggles with. It could be knowing how to use a break stick or safely stopping a dog fight, or ways to interact to stop the behavior from escalating and keeping everyone safe. And then there's training. This includes teaching a dog skills using positive reinforcement. Think of cues such as drop it, leave it, place, or watch me. These can help direct the dog away from triggers without physical manipulation. And then there's behavior modification. This can include counter-conditioning, sometimes used alongside systematic desensitization. Those are techniques used to change emotional responses when the emotional response that leads to the aggressive behavior was conditioned, meaning they are learned and have been neutral before. If the response is unconditioned, these techniques won't help. We cannot, for example, make pain neutral. We can teach dogs that a guardian approaching when they have a valuable resource is of no concern, or that other dogs or visitors are not to be feared. Behavior modification may include remedial socialization for dogs who struggle around other dogs, and it also includes function-based differential reinforcement. This teaches alternative responses or responses incompatible with the problem behavior that lead to the same functional outcome. For example, teaching a dog to go to their safe space to rest as opposed to risking being disturbed and responding with aggressive behavior, or teaching a U-turn to create distance rather than barking and lunging to create distance. All interventions should increase the dog's control over outcome and increase their quality of life. In order to do so, the focus should be on expanding their behavioral repertoire and not use methods which aim to stop the behavior using restrictions or suppression through punishment. Interventions need to be socially valid for the dog, meaning they should address the cause and the function of the behavior and improve their welfare. And they also need to address the safety and welfare of the guardians or others involved. Thank you for watching.